This is Dr. J.Seo, plastic surgery specialist in Area 88. For videos related to this post, please refer to the link in the description box below. Regrading thread lift. I have shown videos on types of thread lift procedures, and its effects. The point was, one should not think of thread lifts as simple, that doctors must know the anatomy well to insert threads in the correct layers, and that realistic expectations of thread lifts are as demonstrated. Otherwise, thread lifts may give rise to incorrect expectations and various problems. Using superfine ultrasonography, we'll take a look at what threads looks like and how they are incorrectly inserted. You can see the thread in the cog. This thread inserted here is a melting thread called mint thread. During the procedure, there are various structures and layers of the face that we must consider. Here is insertion in the superficial fat layer, commonly referred to as the layer joined to the smas. Very often, this thread is inserted piercing through the deep fascia or salivary glands of the face. There are two types of threads with cog, the fixed type and floating type. That is, the method of inserting a cog thread by fixing it to solid regions of the temporal fascia then lifting. Or the method using threads with bidirectional cogs in opposite directions, gathering surrounding tissues then fixing them. Of course, the fixed type can lift better, and this footage is of a fixed type cog thread, but even with the cog affixed, the surrounding tissue under moves like this. This is a video of thread inserted and moving its surroundings. This demonstrates the limitations of thread lift. With threads, one should find satisfaction at this level of result. It cannot be compared to surgery. That doesn't mean surgery can correct all that perfectly. Of course there are areas that cannot be resolved with surgery. The face has several structures depending on the region: the parotid gland, accessory gland, and the submandibular salivary gland. There are actual cases where the accessory gland just below the zygoma or the duct is damaged during thread lifts or surgery. The zygoma region. One needs to be careful because the subcutaneous tissue is thin. In most cases, threads sit piercing through and following the muscles, most representatively the mimetic muscles, zygomaticus minor, major, and malaris muscles. There are some doctors who say they intentionally insert above the muscle, but I don't agree with this. Through magnified superfine ultrasonography you can even see the cog of the thread. You can see that the threads are positioned in the correct layers while avoiding other structures and fascia. This superfine ultrasonographic clip is of a patient who had gotten a facelift at another hospital. During the facelift, a non-absorbing thread called elasticum was inserted. You can see the elasticum thread passing through. The marked area is the submandibular salivary gland area, divided into the lobe in the superficial area and then the deep areas. The thread penetrates both. And thanks to it a cyst has formed in the salivary gland in the superficial area. One mustn't go through that area, one must go over it. In the past during a recording in surgery, I briefly mentioned there are hospitals that insert elasticum during a facelift. There are quite a few places like this. Then they should tell the patient they are going to perform surgery this and that they will insert threads, then insert them. But the patient didn't even know what surgery she had, the hospital explained nothing, and when problems such as mentioned happened they replied they're not sure why. This is why patients become distrustful. Certain hospitals continue to do this. As long as they say the surgery time is short, the recovery is fast, and the results are good. If the initial results are good, it means the surgery was good. Just get surgery, it will fix everything. This seems to be the way people think. There is nothing wrong with getting threads during a facelift. In the past, a surgical method called max lift was popular and is still being performed. It is a method where only the skin is dissected and the smas is not elevated. The smas is pulling on threads. The problem is there isn't proper explanation about the surgery and patients don't know what surgery they are undergoing. The patient can think, I'm sure I came to get a facelift, but it turns out the lift was done through threads. When something like that is found during superfine ultrasonography or surgery, I'd be appalled, and hospitals would assert this logic. They'd make absurd claims such as even in traditional facelifts, Aren't threads used also to fix? That's an entirely different matter. Elasticum or threads with cogs are threads with the purpose of lifting. Then obviously, the patient needs to know the advantages and disadvantages of it and undergo the operation. But since the operation time is short and recovery is quick, you can be lifted the way you wish to be, and it's at a large hospital that is well known and advertised a lot. The patient believes these words and receives the operation. Most respectable plastic surgeons will explain. There are patients who come like this from certain large hospitals, but this operation isn't the only one. I suggest you watch my related videos. There is a reason why we don't do surgeries like Max. It especially does not match Asians whose molars are not narrow. The reason surgeries that claim to be simple and have small incision lines don't last, such as Max or the short scar technique, is because now, with simpler threads and HIFU equipment, patients can get somewhat decent results without the incisions. They're just not outstanding in many ways. We will discuss this separately another time. Thank you.